the last speaker in this section is another friend, Ricardo Dálvora. He started some years ago to working in a portable posturography system, and he will show us the result of using this technology in vestibular patients. Ricardo?
Good evening. You can hear me, you can see me?
Yes.
You can share your presentation. You can see the presentation?
Yes.
Okay. Thank you for the introduction, Sergio. I want to thanks to the organizer of the FINO and FINE the opportunity to present this new and different technology. This aspect that should not be forgotten. I'm actively collaborating in the development of this product. The spatial orientation system basically uses three subsystems: visual, vestibular, and proprioceptive. Posturography is the only study that evaluates the three subsystems in addition to quantifying them. In this opportunity, we present a portable device, easy to use, and it uses a new measurement paradigm based on angular area of the ankle. The fact that it's portable provides numerous benefits that I will explain. What is the new paradigm based on? It is based on the fact that the displacement of the X here from the CG is similar to the alpha angle, where the alpha is less than 14 degrees. This mathematical relationship has an error of less than 1%. The area measured in degrees is proportional here, is proportional to the radians that is the normal measure for the angular area. This little device has a lot of gyroscope and accelerometers in this little box. This device is placed with an elastic band over the internal malleolus. This image shows the interface, the current back here. Above, you can see the previous one. Now we have this. Here are the main difference between BAP and other posturographs devices based on pressure paradigms. Here you can see the difference. In the middle, you have the BAP, our BAP node platform. You can do unipodal test, static assessment 3, dynamic assessment, the dynamic classic pressure paradigm, and our BAP. It's very usual, it's very important to use at bedside because it's very light, very small, and the test speed is very fast in comparison with the others. The value is very low. This is the most important. The great advantage is the cost-benefit ratio. BAP was validated in 2016, and the validation was published 1 year later in 2017. Here the paper. What are the current indications of the posturography? Quantifies each of the subsystems, visual, vestibular, and proprioceptive. Identify the different classical patterns. I think it's very important for the 3PPD to evaluate the degree of dysfunction. For the osteoarticular assessment, ankle and knee, assessment compensation, falling risk, specific rehabilitation, and medical legal importance. What information does the BAP give us? Limit of stability, sway frequency, a sensory organization test with personal balance percentage in the different conditions, the coefficient or sensorial analysis for vestibular, visual, and proprioceptive, diagnostic patterns, and total percentage of the three inputs. Limits of stability. In this image, we can see the loss limit of stability, showing the area with the maximum and minimum angles of inclination over here in two axes, Y and X. The validation identified this value as a normal reference for the loss in this paper. The sway frequency. The sway frequency shows the oscillation per second in hertz or expressed in minutes in the two displacement axes, X and Y, here, for each of all different classical conditions. Here, the paper, here are the different normality values of the sway frequency in different conditions. Sensory organization test. Where the sensory organization test showed the ability, need to close this, showed the ability of an individual to maintain balance under different conditions and its composite, adapted for the different ages. The result is expressing a percentage when 0% indicate 4 and 100% very balance. Here you can see you can see the personal balance in green. You can see the results, and in gray you can see the expected value for age in gray. Sensory analysis, there are coefficients, vestibular, visual, and proprioceptive. The coefficients show the ability of an individual to use a specific reference, such as visual, vestibular, proprioceptive. A coefficient close 0 indicates pathology. Visual coefficients, those patients with visual coefficients close to 0 have low ability to use visual information. They are individuals who present instability with eye closed even on firm ground. Somatosensorial coefficients, those patients with a somatosensorial coefficients close to 0 have low ability to use somatosensorial or proprioceptive information. They are individuals who present instability on soft and unstable floor. Vestibular coefficients, those patients with a vestibular close to 0% have low ability to use vestibular information. They are individuals who present instability on soft and unstable floor with the eyes closed. In this slide, we can see the different coefficients of the analysis, the sensor analysis in back screen, here in the circle, right, the red circle. Diagnostic patterns. Before showing the different diagnostics, it's important to define the difference between preference and dependence. Preference corresponds to input most used. It does not mean that the other inputs are wrong. There is no preference in more than one input. Dependence is always a pathological situation where the patient depends on one sense due to affection of the others. Vestibular dysfunction identifies a descompensated vestibular deficit that can be central or peripheral. The posturography can identify central or peripheral. The patient may fall towards the affect side. If does not, optokinetic stimulation is indicated. Somatosensorial dependence always attend pathological vestibular coefficients. Patients who have a lot of instability or falls on soft and unstable floors. Visual dependence present vestibular and somatosensorial coefficient altered. Patient who presents instability or falls with the eye closed or in dynamic little space. A physiological pattern. The patient tends to fall into the condition where he can control his fall, anxious or simulation. In this image or slide, we can see at the screen back all different diagnoses, diagnosis. The validation study defined the normal value for these different diagnoses. In this image, we can see the normal values for different diagnoses. Total percentage of the 3 reference cakes, different inputs, sorry. We can see at the back the percentage contribution of the 3 inputs here, visual, vestibular, and proprioceptive. In this slide, we can see a recent paper that assesses the vestibular spinal function with the back. The different situation of the study, head tilt, right and left, head shaking, and lateral fast head turning to the right and to the left. Finally, this showed that the great plasticity of this device to study various functions of vestibular, visual, and proprioceptive systems. The slide shows the countries that currently have ABAT right now. Here we have the www.balanceapp.com. Thank you very much for your attention. Thank you, Sergio, and the organizers, the Fino and Fine.
Okay. You want to stop sharing the screen? Perfect. Okay. Any question for Dr. Dalbora? Perhaps we have here some user of this device among the audience. So perhaps they have. Let me tell you that VAP is not a diagnostic tool, even posturography, not necessarily VAP. It's a tool to know how the patient built his equilibrium using the different inputs. Sudhir?
There is a question. It is from Pedro Valente. Great presentation. Can you disclose the price?
I think that is not the place to do that. I think that they had to enter in the web page, and it's a commercial issue. So, but to be practical, the price is 10% of the normal posturography system.
Approximately.
Yeah, 10%.
So, Ricardo, can you hear me?
Yes.
Yes.
That's very nice. I have a question. When you're doing the test, somebody is spotting the patient just in case they will fall?
No. Supporting the patient with the, no.
I don't understand, Jorge.
Te está preguntando si alguien sostiene al paciente, pero no. La respuesta
No.
So you can only do people that are well balanced enough to be able to do this by themselves.
Well, this all depends. In our clinic, we use a hanging system just for safety reasons, but
Yeah.
it's not mandatory. I mean, one of the good things of this system, you can move it from one office to another.
Yeah.
So it's really portable. You know, the size is like a matchbox, and you can put the program in any computer. So you can move from one place to other.
Here is the size.
Well, this is the first user in India, but they say had problem with the software, right?
Yes, it's very fast, that I can say. I have been using the other BRU, the balance rehabilitation unit, and there is no question that the BAP is very fast. It gives you fairly good information in a very rapid and fast reproducible.